All right, now we're on the last module, which is the calf and the foot. So we've talked about the popliteal artery, and the popliteal artery is going to split into two main branches here, the TP trunk, which gives this one branch, and then this other branch is going to go anterior, which is called the anterior tibial artery. The TP trunk will continue straight down into the perineal artery, also called the fibular artery, and give off the posterior tibial artery. So the way I remember this is that the anterior tibial artery has to come out first because it has to go through the interosseous membrane. I'll show you a picture of that in a minute. And that's going to get into the anterior compartment of the calf, or the lower leg, rather. And then the TP trunk is going to be posterior. Let's take a look at that. So again, here's the anterior tibial artery coming off as the first main branch of the popliteal, and then you're going to have this TP trunk going straight down to the perineal, also called the fibular, and it's going to give off the larger posterior tibial. All right. These anterior tibial and posterior tibial are important landmarks for feeling pulses in the foot, because the anterior tibial will become the dorsalis pedis, and the posterior tibial will be palpated behind the medial malleolus. The perineal will come down and terminate above the ankle and give off terminal branches that I'm going to show you in a minute. So this is the three-vessel runoff. When people say there's a normal three-vessel runoff to the foot, they're talking about the anterior tibial artery, the perineal artery, and the posterior tibial artery. Sometimes they'll call this the trifurcation because there's three vessels that are coming out. A true trifurcation is when you have one vessel turn into three, but in this case, it's one vessel turns into two, and then the TP trunk turns into two again. So it's not a true trifurcation, but it's used to describe this area. Here's the anterior tibial artery. Here's the perineal artery. Here's the TP trunk. And this is the posterior tibial artery here, and that's where we're going to palpate the posterior tibial pulse. Okay, and this is an MRA. Again, looking at the popliteal artery from behind, we see that there are, it goes down, gives off an anterior branch, which is going to go, which is the anterior tibial artery right here. Then it's going to turn into the TP trunk, and it's going to give off the perineal and the posterior tibial artery. If you look over here, this hole in the interosseous membrane is where the anterior tibial artery is going to come through. And so it's the first branch off the first large branch off the popliteal artery below the knee, right here, going anterior, going through this foramen, and supplying the anterior lower leg. Here it is, the anterior tibial artery. It's gone through the interosseous membrane. This is a cross-section, mid-calf, interosseous membrane here. So it's gone anterior. It's gotten in this anterior compartment. And the posterior tibial artery is here, and the perineal artery or fibular artery is here. And again, this is the interosseous membrane here with the anterior tibial artery here, which is in front of it. And you're going to have the posterior tibial artery and vein and the perineal artery in this deep compartment, deep posterior compartment right here. All in here, right here. Here's another patient with a very abnormal looking angiogram, CT angiogram. Here you have three vessels. So again, this would be the anterior tibial artery, and this is going to be the perineal, also called the fibular. You can remember it because it's the perineal nerve is lateral, and the perineal artery is going to be lateral, and it's also called the fibular artery, and the fibula is lateral. And then you have the posterior tibial artery, and that's medial. And you can remember that because that's the pulse that you feel behind the medial malleolus when you're doing an assessment of a patient. In this case, we have this large expanded saccular arterial filling balloon-like structure that's associated with this artery. And it's so if this is the anterior tibial artery, because it's anterior to the interosseous membrane right here. And the leg is a little bit rotated laterally, which is why it looks like that. But this is anterior interosseous membrane. So this is either going to be the perineal or the posterior tibial. And in this case, we only see one vessel here. Maybe the other one's occluded, but it really does look like it's about in the same location as this. So it's going to be the perineal artery. There's mass effect pushing it posterior, but it's a perineal. And that's a strange place to develop a pseudoaneurysm. So usually pseudoaneurysms like that are going to be mycotic, meaning that they're infected. And that in this case, it probably came from some infected clot that in this patient with IV drug use migrated and embolized down from, for example, the heart valves or somewhere like that. The treatment of this kind of thing is, there's a number of ways to do it. I'm not sure of the right way. I certainly have treated these with coils. I've injected things like this with thrombin, and you can operate and then ligate and remove the pseudoaneurysm as well. All right, so we mentioned a little bit about the dorsalis pedis, which is a continuation of the anterior tibial artery. Here it is right here. This is just a dorsalis pedis aneurysm. Here is the aneurysm. Here's the loops around the dorsalis pedis artery, the anterior tibial artery as well. And it's very easily palpated in most patients between the extensor hallucis longus tendon and the extensor digitorum longus tendon. And you can just palpate it right there. So it's right on it's a prominent artery on the dorsum of the foot. Obviously, if you have obesity or diabetes or atherosclerosis, things that make palpation of a vessel harder or cause disease of a vessel, then you may have to use a Doppler to look for the vessel. Or maybe it's not there. Maybe it's thrombosed or occluded from athero. Here's the posterior tibial artery right here going posterior to the medial malleolus. And this is also called the common plantar down here because it's going to give off vessels to the plantar arch. We're almost done. Let's continue to talk about the foot. So essentially you have the common plantar artery here. So the posterior tibial is going to come down and become the common plantar. The common plantar artery is going to give off the medial plantar artery and the lateral plantar artery, and those are going to supply the plantar surface of the foot. There is a deep plantar arch that is on the plantar surface, and directly opposite that on the dorsum of the foot is the arcuate artery, and these send branches that go between the metatarsals. All right, so there's two arches of the foot. There's the arcuate, which is on the dorsum, and then there's the deep plantar arch. All right, so the anterior tibial artery comes down, becomes the dorsalis pedis. That's where we saw that aneurysm on that prior slide. Comes on down, and it's going to become the arcuate artery, and it's going to give off branches that are going to go to the deep plantar arch. We haven't talked enough about the perineal. The perineal will come down, and it terminates, as I mentioned before, above the ankle. It gives off a calcaneal branch and an anterior malleolar branch here. And what these do are just the perineal artery is an important collateral path should you have occlusion of one of these vessels, because you can imagine if I occluded the posterior tibial, for example, then this perineal artery will come in and fill distal branches of the posterior tibial, like the common plantar, for example, via this calcaneal branch, it'll get quite large. And the same thing will happen if the anterior tibial is occluded or the dorsalis pedis. The anterior malleolar branch comes in and saves the day and still supplies the dorsal surface of the foot. Here we are getting another look at the anterior tibial artery and the posterior tibial. And the posterior tibial is going to come down, go behind the medial malleolus, and it's going to give off the lateral plantar and the medial plantar. And they're all going to collaterally fill each other from these two two arches. One is deep and one is just the arcuate, which is on the dorsum. So let's go through a case. This is an 85-year-old female with a heel ulcer, and we start with an angiogram, and we see that this is the aorta up here. This is the right common iliac artery. This is the left common iliac artery. This is the internal iliac here. This is the internal iliac. We've obliqued this so that it's in the LAO position, so that we can that splays out the external iliac artery and the internal iliac artery on the contralateral side. So an LAO gives you good distinction between the right external and right internal. Vice versa is true. A RAO will give you distinction between these vessels. So we see we're coming down here. Everything looks pretty good. Don't see any problems. Now we're doing the other contralateral obliquity. So this is going to be an RAO to look at the left internal iliac and left external iliac. Remember I said before that the external iliac doesn't have many branches, and it's true. Here it is. See, there's no branches here until you get down here. And we start to do a runoff where we take pictures as we move down the leg and the thigh. We see that there's some irregularity here, but nothing looks too bad. And then we see occlusion here. And here we're below the knee. So this is the popliteal artery. It's giving off, remember that first branch, it's going through the interosseous membrane right here. Here's the tibia, here's the fibula. It's going through the interosseous membrane, so that's the anterior tibial artery. There's a high-grade stenosis. Here's the TP trunk, which is occluded, and the perineal is the straight down continuation of the TP trunk. Here's the perineal here. So it looks okay, but it's definitely, the TP trunk is occluded. Here you have the anterior tibial artery, and you see there's some irregularity here of the TP trunk, and there's just a continuation of this vessel coming down, and that's the perineal. As you go further down, we're still trying to understand what's going on, and so obviously a little bit of confusion. But remember how I said that was the perineal? Here it is. Here's the perineal coming down. I know it's the perineal because it's a straight continuation of the TP trunk. And I know it's the perineal because if I follow that vessel down, it stops above the ankle, as I mentioned before, and gives off terminal branches to supply the foot to the anterior tibial branches here and the posterior tibial branches here. On this side, it's kind of confusing. You have the anterior tibial arteries coming down here, and this is the perineal. The posterior tibial artery on both sides is out. But this is where the posterior tibial artery should be, right about in here. So we try to fix this. Here's a better picture of this occlusion. And we put a wire that goes all the way down, and that went into the posterior tibial artery, which is not filling. So we pulled that back and put it right down in the perineal. And then you just balloon up, and you can see there's a little waist on the balloon, and you just angioplasty, and voila, here we have a TP trunk that's restored. It looks a little irregular, but pretty good. And there's a high-grade stenosis here of the anterior tibial, and pore filling distally right here with a collateral going around it. And we angioplasty it, and it looks great. So this is another patient with pain And if we do these angiograms here, we look down and we see we're looking at the thigh. And in this case, we see the superficial femoral artery with some branches. And we see that we have the popliteal artery occluded just above the knee joint. And here you have these huge branches coming down, and these are the sural branches that are those posterior branches that I mentioned. Those are going to supply a lot of they're going to go down and fill collaterally branches of the posterior tibial artery and the anterior tibial artery. And you can see they actually do a pretty good job. Here's the posterior tibial, here's the anterior tibial, here's the perineal. So even though you have severe atherosclerosis above or embolic occlusion above, and here there's clips and God only knows what's going on, you can have really good flow distally because of these collaterals that we focus on during this talk. Here's another angiogram of that same patient of the foot. Here's the posterior tibial artery, and it's going to give off the common plantar here. And then here's the anterior tibial artery giving off the dorsalis pedis here, with going into the arch, the arcuate artery here. I don't see the deep plantar arch, but I think it's because these haven't filled in all the way. So those sural arteries are important collaterals. Here they are. That's a lot of these. If you ever want to see good vascular anatomy, I mentioned Netter, but I think the Uflacker's book on vascular anatomy is a great book. I recommend that. And that's all I have to say. Thank you so much for allowing me to talk to you about lower extremity arterial anatomy. I appreciate it.